women have a difficult time getting pregnant and turn to fertility treatments. This week is Infertility Awareness Week, and here to tell us more about what women can do, we have Dr. Stephanie Singleton with the Fertility Center of Charleston. Dr. Singleton, thank you so much for making time in your busy schedule to come on and talk to us about this very important issue. You know, Dr. Singleton, I have cousins and I have dear friends who are struggling with this issue right now. What are some of the myths associated with infertility?
Right. So it's a very common thing. You know, patients think that it's getting worse and worse in time, and I think we're just getting better at evaluating it. We're better at figuring it out, better at treating it. I think that more people are being more open about having the issue, thank goodness. So it is allowing more and more people to come forward and to find out what is going on, what's causing their issues so that they can undergo treatment.
And it's very prevalent. I've read that 1 in 8 couples struggle with infertility.
Absolutely. Very, very common. Not everyone is open and talks about it, thank goodness. There are some people that will, so that people understand that they have support out there. And it comes in many different varieties. Sometimes it's on the male side, sometimes it's on the female side. It can happen when you're younger, it can happen when you're older. Certainly age plays a huge factor. And we know that it gets harder for all women to get pregnant as we get older. So age is an important part of infertility.
So it's a good thing that we're having these discussions right now.
Absolutely.
Right.
And we hope more and more women, more and more families will talk about it so that patients who are at home or couples that are trying to get pregnant will go ahead and come in and be evaluated if they need that.
And then a lot of times people think that it's mostly the woman who has the problem.
Right. And actually about 40% of the time it can actually be on the male side. And about 20% of couples actually have more than one issue. So if you know that you have a sperm issue, that doesn't mean that that's the only problem that could be involved. We still want to evaluate egg making ability, still want to evaluate the uterus, the fallopian tubes, to make sure it's not more than one factor that we need to address.
And then also some people are really concerned about the costs of treatment.
Absolutely. That's always something that patients fear before they come in. They should know that at the Fertility Center of Charleston, anytime they come in for an appointment, they're also going to meet with a financial counselor. Some people have coverage for fertility treatment, so the counselor is going to help them to figure that out so that they always know ahead of time what that cost is going to be. We also work with cost-saving programs with medications. So it is not always, you know, a difficult financial issue. We try to make it as easy as possible.
So while the Awareness Week wraps up at the end of this week,
absolutely.
we want to continue to keep the conversation going.
Absolutely. We appreciate you recognizing it. I know all those couples out there do, and hopefully get patients to come in so we can have more babies in this world.
Okay. Thank you so much, Dr.
Thank
Singleton,
you.
for joining us today.
We appreciate it.
Okay.